Module overview. The cardiovascular system is a closed circulatory system composed of the heart, blood vessels, and blood, responsible for delivering oxygen, nutrients, hormones, and removing metabolic waste throughout the body. It operates as a dynamic and integrated transport system essential for maintaining homeostasis, cellular respiration, immune defense, fluid balance, and thermoregulation. This module provides a robust understanding of the anatomy and physiology of the cardiovascular system, integrated with clinical correlations, disorders, diagnostics, pharmacological treatments, and emergency care relevance. 1. Anatomy of the heart. A. Location and coverings. Located in the mediastinum, tilted slightly to the left, enclosed in a double-walled sac. Fibrous pericardium, serous pericardium, parietal and visceral layers with pericardial fluid. B. Heart chamber's right atrium, receives deoxygenated blood from superior and inferior vena cava. Right ventricle, pumps blood to lungs via pulmonary artery. Left atrium, receives oxygenated blood from pulmonary veins. Left ventricle, pumps blood to body via aorta, thickest wall, most muscular chamber. C. Heart valves atrioventricular. AV. Valves tricuspid, right side, bicuspid, mitral, left side. Semilunar valves, pulmonary valve, aortic valve. D. Cardiac wall, layers, endocardium, inner lining, myocardium, muscle layer, epicardium, outer surface. Second, conduction system of the heart. Sinoatrial SA node. Pacemaker initiates heartbeat 60 to 100 beats per minute. Atrioventricular AV node. Bundle of his right and left, bundle branches, Purkinje fibers. These generate and transmit electrical impulses that cause the heart to contract in a rhythmic and synchronized manner. Intrinsic conduction system. Third, blood vessels and circulation. First, vessel, type second, function. Third, features, arteries, carry blood away from the heart. Thick walls, high pressure. Arterioles, distribute blood to capillaries, site of resistance and regulation. Capillaries, exchange of gases, nutrients. Waste, microscopic, thin-walled, venules, collect blood from capillaries, begin return to the heart. Veins, carry blood to the heart. Thin walls, valves prevent backflow. 4. Major circulatory pathways. Pulmonary circulation, heart to lungs to heart. Systemic circulation, heart to body to heart. Coronary circulation, heart tissue blood supply. Portal circulation, gut to liver to heart via hepatic portal vein. Fetal circulation, ductus arteriosus, foramen ovale adaptations. 1 complete heartbeat includes 1. Phase 2. Event 3. Notes. Atrial systole. Atria contract blood forced into ventricles. Ventricular systole. Ventricles contract AV valves close. S1 sound lub. Diastole. Relaxation of all chambers. Semilunar valves close. S2 sound on dub. Duration approximately 0.8 seconds. Heart rate normal Buxton 60 to 100 beats per minute. Stroke volume 70 milliliters per beat. Cardiac output Trachis heart rate x stroke volume. 6th, blood pressure BP. Systolic BP, pressure during ventricular contraction. Diastolic BP, pressure during relaxation. Normal BP, approximately 120 over 80 millimeters of mercury regulation. Mechanisms: baroreceptors, aortic carotid sinuses, renin-angiotensin-aldosterone system RAS, sympathetic parasympathetic nervous control antidiuretic hormone ADH. 7. Blood composition and function. Component function: red blood cells RBCS, transport oxygen hemoglobin, white blood cells WBCS, immune defense platelets thrombocytes, clot formation, plasma transport nutrients, hormones, waste, Clinical applications and disorders, disorder, description, symptoms, hypertension, persistently high blood pressure, headache, dizziness, asymptomatic coronary artery disease, narrowing of coronary arteries, chest pain, angina, shortness of breath, myocardial infarction, heart attack due to coronary blockage, chest pain, sweating, nausea, arrhythmias, irregular heartbeat, palpitations, fainting, congestive heart failure, inefficient pumping, swelling, fatigue, fluid retention, stroke, ischemic or hemorrhagic, brain blood supply interrupted, weakness, confusion, paralysis, shock, hypovolemic, cardiogenic, septic, life-threatening low perfusion, rapid pulse, cold skin, confusion, learning outcomes map to Bloom's taxonomy. First level second learning objective. Remember, identify major heart structures and blood vessel types. Understand, explain the cardiac cycle and blood flow pathways. Apply, interpret a blood pressure reading and ECG results. Analyze. Differentiate between systemic and pulmonary circulation. Evaluate. Assess clinical interventions for a cardiovascular disorder. Create construct. A flowchart of blood flow through the heart and major body systems. Accreditation framework alignment. First, standard agency. Second, description NCLEX, US. Fully mapped to cardiovascular physiology and pharmacology, NMC, UK. Covers anatomy, blood flow, pathology, and clinical application. WHO Global Curriculum for Health Workers integrates health system and emergency preparedness. Africa CDC/Nursing Council, Nigeria, Kenya, Ghana. Meets regional accreditation and competency frameworks. CPD/CEU eligibility, Europe, US. Strong foundational alignment with continuing education units. Activities and assessments. Heart dissection lab, virtual or physical. Blood pressure measurement, practical ECG waveform interpretation exercise. Case studies of MI, hypertension and CHF, cardiac cycle, diagram labeling task.